If you are over 60 and think you know what to do during a heart attack, stop for a moment and listen carefully. I heard something terrifying last month in my own hospital's emergency room. A 68-year-old man was having a massive heart attack. His wife called 911 immediately when he clutched his chest. The ambulance arrived within 8 minutes. Paramedics started treatment in the ambulance. He reached our cardiac catheterization lab within 40 minutes of his first symptom. He survived. His heart damage was minimal. But in the bed next to him was another patient, a 63-year-old woman who waited 6 hours before coming to the hospital. She thought her chest discomfort was indigestion. She took antacids. She rested. She waited. By the time she arrived, significant portions of her heart muscle had died. Her recovery would be long, difficult, and incomplete. What separated these two outcomes was not the severity of the heart attack. It was not their age or overall health. It was the actions they took in the critical first minutes and hours. New research shows that one very common heart attack response mistake, especially in adults over 60, can mean the difference between minimal heart damage and permanent disability or death. I'm Dr. Maria Hernandez and I'm a cardiologist. And in this video, I will tell you exactly what I would do if I had a heart attack tomorrow. Not what the textbooks say, not what we tell patients in general terms, but the specific step-by-step actions I would take to give myself the best possible chance of survival and recovery. Before we dive in, drop a comment with your age and where you're watching from today. Have you ever experienced chest pain that scared you? Or do you know someone who survived a heart attack? Write your answer below because your experience helps our entire community. And hit that subscribe button because I share life-saving heart health strategies like this every week to help you thrive after 60. Most people believe they understand heart attack symptoms: chest pain, left arm pain, sweating, shortness of breath. But in adults over 60, especially women, that assumption can be deadly wrong. Heart attacks in older adults often present differently than the classic symptoms you see in movies. Without recognizing the real signs, precious time gets wasted. That is why early recognition is often the difference between life and death. By the time obvious symptoms appear, heart muscle may already be dying. Here is the problem. As we age, our perception of pain changes. Diabetes, which affects millions of seniors, damages nerves and reduces pain sensation. Medications we take for other conditions can mask symptoms. Our bodies simply do not signal distress the same way they did when we were younger. By the age of 60, more than half of all heart attacks occur in this age group. Our arteries have accumulated decades of plaque buildup. Our heart muscle has less reserve capacity. Each minute of delayed treatment destroys more heart tissue permanently. I saw this clearly with one of my patients named Robert, age 71. He felt unusual fatigue for 3 days. He had mild discomfort in his upper back. No chest pain, no left arm pain, no dramatic symptoms at all. His wife noticed he looked pale and was sweating more than usual. She insisted they go to the emergency room. He resisted because he felt it was nothing serious. When he finally agreed, we did an EKG immediately. It showed a massive heart attack in progress. His main coronary artery was 95% blocked. What most people do not realize is that heart attacks do not always announce themselves with crushing chest pain. In older adults, they can present as fatigue, jaw discomfort, back pain, nausea, or simply feeling unwell. Women especially experience atypical symptoms more frequently than men. In people over 60, waiting for classic textbook symptoms often means waiting until significant heart damage has already occurred. This is why so many seniors arrive at the hospital too late and face much harder recoveries. Now, here is where the first major mistake happens. Most seniors try to diagnose themselves before calling for help. They assume their symptoms are something less serious: indigestion, muscle strain, anxiety, tiredness. But in people over 60, this self-diagnosis approach is extremely dangerous. Heart attack recognition requires immediate medical evaluation, not home assessment. With age, the stakes become higher, and the margin for error becomes smaller. Every minute of delayed treatment means more heart muscle dies. Without immediate action, survivable heart attacks become fatal ones. This is not rare. It is extremely common. That 63-year-old woman I mentioned earlier spent 6 hours trying to convince herself it was acid reflux. She took Tums. She tried to burp. She told herself she had eaten something that disagreed with her. Meanwhile, her heart muscle was dying cell by cell. When proper emergency treatment finally started, half of her heart's pumping function was permanently lost. This is why immediate recognition and action matter far more than waiting to be absolutely certain. If you're finding this helpful, go ahead and hit that like button. It really supports the channel and helps us reach more seniors who need this information. Now let me tell you exactly what I would do if I experience potential heart attack symptoms, and this first step is the most critical. Step number 1. I would call 911 immediately without any hesitation or self-diagnosis. If you look at most people's response to potential heart attack symptoms, they delay, they wait, they try to decide if it is serious enough to call for help. They worry about being embarrassed if it turns out to be nothing. But as a cardiologist, I know something most people do not understand. The ambulance is not just transportation. It is mobile cardiac care that starts treatment before you reach the hospital. That early treatment saves heart muscle and saves lives. In adults over 60, every minute between symptom onset and treatment matters desperately. Paramedics can perform EKGs in the ambulance. They can transmit that EKG directly to the hospital. They can alert the cardiac catheterization lab. They can start medications immediately. They have defibrillators if your heart rhythm becomes dangerous. All of this happens while you are being transported, saving 20 to 40 minutes of critical time. I saw this with a patient named Catherine, aged 66. She woke at 3 a.m. with chest pressure and nausea. Her husband wanted to drive her to the hospital. She insisted on calling 911 instead. The paramedics arrived within 7 minutes. They performed an EKG in her bedroom. They saw a massive heart attack in progress. They immediately notified our hospital's catheterization lab team. They started medications in the ambulance. By the time Catherine arrived at the hospital, our entire team was ready. We took her directly to the catheterization lab. Within 18 minutes of her arrival, we had opened her blocked artery. Her total time from symptom onset to treatment was 52 minutes. The American Heart Association calls this door-to-balloon time, and the goal is under 90 minutes. Catherine's heart sustained minimal permanent damage because of rapid treatment. Research shows that calling 911 instead of driving yourself to the hospital reduces treatment time by an average of 30 to 60 minutes. For heart attack patients, this time difference can mean 30 to 40% more heart muscle saved. Another critical reason to call 911 is safety. If your heart rhythm becomes dangerous while driving, you could crash and kill yourself or others. Heart attacks can cause sudden cardiac arrest without warning. If this happens at home with paramedics present, they can shock your heart back into rhythm immediately. If it happens while you are driving alone, you will die. There is also a dangerous misunderstanding about bothering emergency services. Some people worry that their symptoms might not be serious enough to justify calling 911. They fear embarrassment if it turns out to be nothing. In reality, emergency services would much rather respond to 10 false alarms than miss one real heart attack. Paramedics and emergency physicians never judge patients for seeking help with chest discomfort. We are grateful when people call early rather than late. The key lesson here is simple. If you are over 60 and experiencing any chest discomfort, pressure, squeezing, unusual fatigue, nausea, jaw pain, back pain, or shortness of breath that feels different from normal, call 911 immediately. Do not wait to see if it gets better. Do not convince yourself it is probably nothing. Do not drive yourself to the hospital. Call 911. Now we come to the second critical action, and this one can prevent sudden death. Step number 2. While waiting for the ambulance, I would chew and swallow 325 milligrams of aspirin immediately. Many people either skip this step entirely or take aspirin incorrectly. They swallow it whole with water. They take baby aspirin thinking smaller is safer. They hesitate because they are not certain it is really a heart attack. Aspirin works by preventing blood clots from getting larger. Heart attacks are caused by blood clots blocking coronary arteries. During a heart attack, every second counts. Aspirin must be chewed, not swallowed whole, because chewing allows faster absorption through the mucous membranes in your mouth. This gets aspirin into your bloodstream 5 to 10 minutes faster than swallowing. I saw this pattern in a 69-year-old patient named James. He experienced chest pressure while watching television. His wife immediately gave him aspirin. She made him chew it thoroughly. She called 911 while he was chewing. When paramedics arrived 9 minutes later, the aspirin was already working. His blood clot stabilized. His EKG showed a heart attack, but the damage was limited. Had he waited until the ambulance arrived to take aspirin, he would have lost those critical 9 minutes of clot prevention. Another overlooked issue is the correct dose. Regular strength aspirin is 325 milligrams per tablet. Baby aspirin is 81 milligrams per tablet. During a heart attack, you need 325 milligrams total. This means 1 regular strength aspirin or 4 baby aspirins. Many seniors keep only baby aspirin at home and take just 1 tablet thinking that is sufficient. It is not. The dose matters. Finally, chewing is essential. I cannot emphasize this enough. Swallowing aspirin whole delays absorption by 20 to 30 minutes because it must reach your stomach, dissolve, and then absorb through your intestinal lining. Chewing creates a paste that absorbs directly through your mouth tissue into your bloodstream within 5 minutes. For heart attack treatment, the exact protocol I would follow is this. Take 325 milligrams of aspirin, chew it thoroughly until it becomes a paste, swallow the paste. Do this immediately while someone else calls 911. If you are alone, call 911 first, then chew aspirin while staying on the line with the dispatcher. The American Heart Association and American College of Cardiology both recommend aspirin as first-line treatment for suspected heart attack. Research shows that taking aspirin during a heart attack reduces mortality by approximately 23%. That is nearly 1 in 4 deaths prevented by a simple action, taking less than 60 seconds. By this point, you may realize something important. The first minutes of a heart attack are when you have the most control over your outcome. What you do in those minutes matters more than almost anything else. Each correct action increases your chances of survival and full recovery. Together, calling 911 immediately and taking aspirin can mean the difference between life and death. Now, let me walk you through the third critical action I would take. This is the approach that maximizes survival during those frightening minutes while waiting for help to arrive. Step number 3. I would sit or lie down, stay calm, loosen tight clothing, and focus on slow breathing. For most heart attack patients, panic is natural but dangerous. But panic increases your heart rate. It raises your blood pressure. It makes your heart work harder at exactly the moment when it needs to work less. Your heart muscle is already struggling because of blocked blood flow. Panic forces it to pump faster and harder, requiring more oxygen when oxygen supply is critically reduced. This alone can dramatically worsen heart damage. I had a patient aged 72 who followed this protocol perfectly. His name was David. He woke with severe chest pressure at 5 a.m. Instead of panicking, he woke his wife calmly. She called 911 while he chewed aspirin. Then he sat in his recliner, loosened his collar and belt, and focused on breathing slowly and deeply. He consciously told himself to stay calm. When paramedics arrived, his heart rate was 78 beats per minute. His blood pressure was manageable. His oxygen saturation was good. This stable condition allowed paramedics to treat him effectively without complications. In contrast, I have seen heart attack patients who panic and pace around their homes. Their heart rates climb to 120 or 140 beats per minute. Their blood pressure spikes. Their oxygen levels drop. They sometimes trigger dangerous heart rhythms that require immediate shock treatment. Some experience cardiac arrest before reaching the hospital. The specific actions I would take are these. First, sit down immediately. Do not walk around. Do not go upstairs to change clothes.